Back pain is one of those things that can really affect us mentally a lot more than many other conditions, many other injuries, and it's something that's not talked about a lot. And it leads us to feeling a state of disempowerment. We don't know what to do. We don't know if we've got an ability to solve the problem, a whole host of other problems along that sort of line of reasoning. And in this video, we're going to talk a little bit about that. Hopefully it's going to give you a bit of encouragement, help you better understand why maybe that's the way you feel. And more importantly, know please from the outset of this video that you're not the only one. It is really, really common, and it's something that's not talked about a lot at all, which is why it feels even worse. It feels even more isolating because you feel like you're the only one that's feeling like that. So this is a bit of a different video compared to the usual videos on the channel. We're going to talk about a few different things, and hopefully as you go through, you're going to maybe ask some questions of yourself, ask some questions of the previous history you've had, ask some questions of maybe have you been doing things right, and more importantly, are there things that we could do better? Because if we can do things better, then that starts to bring some of that control back on board. But let's first take a step and have a look at why we lose that control, lose that feeling of control over the problem in the first place. The first real cue, and we've seen this over the years, is the way in which we talk about back pain. People would come into the clinic and they'd say, hey, you're going to fix my back pain, or, this is a tough one for you to fix this time, or something like that. Almost having like a medal of their back problem is worse than anyone else's, and they've seen lots of people that couldn't fix their back problem, and it's another challenge for you. And it always raises, to a certain degree, some of these red flags, because what's happened is that person has had lots of different treatments, lots of different treatments have failed. And it's really a failing of the people that they've seen along the way that haven't really imparted a wiser approach to them. But it's, I saw that person and they didn't help me. I saw that procedure and that didn't help me. I had that treatment and that didn't help me. I had that injection, I saw that surgeon, I saw that GP, and they didn't help me. And that's the real problem. Do you know just one thing about all of those statements? Is that they didn't help me with my back that I live with 168 hours of the week every week, and I saw them once. And if that's the approach you're taking, we're basically subconsciously or consciously saying that someone else has to fix my problem. And that is where all the power, all the agency that you have starts to seep away. Now, we're going to start to understand and unpack why that's a problem over the long term. But if that's the approach we've taken to start with, maybe because someone said, oh, do this and it'll go away, and that's the fault of the practitioner, to be honest. Maybe someone said do this particular thing, or take this particular medication, or do this particular procedure and it will go away. Well, that already sets up the terminology, the language that we use when we talk about getting that initial treatment, sets up the ability for you to then fall into that trap of someone else is going to fix my problem for me. So we're not saying it's your fault at all, but we're just recognizing how you might have got to this particular position in the first place. And remember, this might have taken place. You might be watching this video having 10 years of a back problem, and we'll start to see that the things that have led to that maybe started 10 years prior, or more, or less, depending on the particular case and how long you've had your issues for. So with that kind of little tangent out of the way, let's look at what exactly is going on here. We've got one treatment. Let's just use the treatment as an example. Let's say we went for a treatment with an osteopath, a physio, or a chiro, or something like that, and we had a 1-hour treatment. And maybe you did that once a week for a couple of weeks after having the back problem for a couple of months. That's 1 hour of treatment in a 168-hour week where we've said that treatment didn't work for me. Well, what about the other 167 hours? Now, granted, some of that we're sleeping, some of that we're doing other bits and pieces, but that's 1 hour of treatment, or one injection, or one consultation in a whole host of hours that have possibly been making things worse, or at the very least not been helping contribute to the overall well-being of you and your body's condition to heal. Because let's face it, no matter what injury we get, what infection, what illness we get, our bodies are very, very good. They are the things that are doing the healing. When you take a pain medication, when you take a procedure, when you take a treatment, the intervention itself is only helping you and your own body actually go through a healing process more effectively. In lots of cases, it's actually just removing some of the barriers of that recovery in the first place. So if we go back to that 168 hours, when we think about it, we're putting all our eggs on someone else trying to help us. Even if they were the best in the world, they've only got 1 hour to offset a substantial amount of time outside that, where a whole host of things that can't be controlled are affecting your back, because your back is being used every single day. When you're sleeping, it's off weight bearing. It's supposed to be going through a healing process. It's supposed to be re-imbibing those discs with fluid, getting rid of some of the waste products. When we're upright and about, it's being used and potentially abused through daily tasks, daily activities. And those things add up, and they add up a lot. Now, if we pause for a moment to consider prior to actually seeking out that appointment, that treatment, that intervention, whatever it is, maybe that decision to do something good. Maybe it's exercises, for example. Prior to that, there will have been a whole host of time when we haven't been paying attention to these things. Now, what are these things? Because this is the important part of the video. This is the bit that's hopefully going to give you back a bit of power. Now, we already said that your body heals. Your body heals itself, but it needs resources to do so, and it needs stimulation to do so. And we've got a whole host of things. We've got our nutritional regime. Are we giving our body the right resources that it needs to be healthy? This is before back pain, by the way. This is before you had the injury. And it becomes obviously more necessary when our body's trying to recover from an injury. Because we all know, once you throw a spanner in the works with an injury, the fluidity, the way in which we've developed through our teenage years, at a time we've adapted to new stresses and strains, at a time when our body's most adaptive, it's never going to be that adaptive as it is when we are younger. We've adapted uninterruptedly. But when we throw a spanner in the works later on in life, an injury, it does throw things a little bit, and we need to give ourselves a bit of time to recover. But the nutritional regime, the food that we're taking on board, eating well, not eating rubbish is important. Having good body weight is important. Having the access or doing cardiovascular exercise to keep our heart healthy, because how on earth are we going to get nutrients to and waste products away from that injury if we haven't got a good circulatory system, the perfusion of capillaries into tissues, all those sorts of things, the ability to provide oxygen to those tissues, amongst other things, is really, really important. How much time have we been doing strength training, developing our musculoskeletal system, and through strength training, training the bones, because the bones will get stronger, the joints will get stronger, the ligaments will get stronger as a result of those things. How much time, stop, maybe even pause the video right now and think how much time of that 168 hours every week have we spent doing that? How much time have we spent moving correctly on a daily basis? Are we always bending, rounding the lower back, twisting down to hook the dog lead on, or to empty the trash, or whatever it may be? Or are we moving correctly? Maybe we're doing some of that stuff and it's doing good. How much time we spend sat down in the same position, rounded over the desk? In many cases, especially up until a couple of years ago, it's been very, very sedentary, rounded over, where it's sat in those cubicles and those desks, not necessarily with the best setup for long periods of time, putting more pressure through those structures in the lower back. Or conversely, have we been using sit-standing desks? Have we been doing good practices? These are areas that we need to consider. And of course, let's not forget the actual resistance training or rehabilitation exercises for our back pain in the first place to actually rehabilitate effectively. How much time are we devoting to these tasks? Now, I've mentioned a number of different things. As I said, pause the video, evaluate how many of these have you been doing consistently over a long period of time, prior to the back pain or the back injury and since the back injury. How many hours of those 168 have we been really working on those things? Now you might be thinking, why is this relevant to the mental health? Well, the reason this is relative to the mental component of back pain is because if we're not addressing those things and we're not even thinking about those things, the only thing we can think of to help our body's condition, our ability to recover from the back, is someone else helping us. As we mentioned at the start of this video, it's that consultant, it's that treatment, it's that this, that and the other, that gadget, whatever it may be, it's that thing. Now what you need to do from the end of this video is start looking at those things we mentioned. Know that actually we mentioned a whole host of things which you could spend hours every single week addressing, working on consistently. And there's one message from this video: it's the more you do, the more you can do. Now your body is going to be trying to heal itself every single day. Your body is continuing to work. Whether or not you've got a back problem, it's still trying to heal. It's just there's so much of you in the way that's not allowing it to heal that's the problem. Now you start off, you maybe do some good exercises, you do some good rehab, like phase 1, for example, or some of the other phases in the Back in Shape program. You address that, and that's a couple of those 168 hours have been taken care of. You're going to do that there. You go and address the movement patterns that you're doing on a daily basis, how you move, and you start to do those two things together. That's another thing. And as you start to do those two things, the exercises, and modify some of your activities, you start to get a little bit more strength back. You start to be able to do things. So your back can go through a bit more of a healing process. It can get a bit more momentum with its healing. Not quite there yet, but it can get a little bit more momentum because you're protecting a little more, you're a bit stronger now, and you're doing less aggravation on a daily basis. It's got a little bit stronger. Now you think, oh, well, do you know what? They said add in nutrition. You look at your nutrition, you say, maybe I could get a bit more protein, maybe I could get a few more calories, good food, good nutrients on board, and you add that in. And that's another maybe hour or so a week, something like that, a couple of hours a week that you spend working on that aspect of things in tandem. And now all of a sudden your back starts healing a little bit faster. Your rehab starts improving faster because you're giving your body more nutrition. Therefore, you're able to do more things around the house, be more active, you start to feel better. All of a sudden, you're doing 3 different things that are in control of you. 100%, you're in control of those things. And now you start to get more done. The more you do, the more you can do. And then the more you can do again. And that will start to build momentum. And it might be that you've got a longer road to go, and that's okay. But the more you do, the more you can do, and the faster you will get to that position that you want to be in, which is essentially dealing with this back problem once and for all. So as you've made those 3 changes, you go and look at things like supplementation. You go and look at things like adding in a sitting standing desk. That sort of, and then we've taken away an aggravation, a bad, and we've added in a good thing. All of these things are things that you should be doing. And sure, we could have the consultation with the specialist, the GP, the whoever. Sure, we could have the treatment with the Chiro, the Physio, the osteopath, the Chinese specialist, whatever it is. You could have the treatment, the acupuncture, etc. You could have the massage gun and do the work there. You could do all of that. But those are those little 1 hours here and there. And most of the time we don't do them every week. We do them once every so often. We do them here and there, especially sort of the GP visits, the specialist visits, or if you have injections or surgery, they're one-off procedures. They're not every single day. But if you're doing all of those things we've mentioned that you can do, then you're going to enhance the effectiveness of those things. It's always better if someone has a treatment alongside doing proper rehab, alongside taking care of the nutrition, alongside the correct supplementation, alongside the correct habits at home, alongside changing their working environment and their working habits. You get the picture. There's a lot of alongside, and a lot of that alongside is stuff that you have control over. And if you've unfortunately been discounting those things, as we said at the start of the video, because initial approaches to deal with this situation maybe set in mind that someone else was going to fix the problem for you. If you've been discounting all of those things and weren't even aware of them or hadn't thought about them, then you're going to feel a bit disempowered. You're going to feel a little bit like you can't do anything about this. And that's not good, because that's the downward spiral. But if you follow, rewind the video about a minute or so ago, you see the upward spiral. The more you do, the more you can do. And conversely, the less you do, the less you'll end up doing, and the worse you'll get. And that dichotomy, that parallel between those 2 different outcomes, the big difference is what's happening up here. And once you get a bit of momentum, it really starts to build. I know it's been a bit of a different video. Hopefully, it's really helped you maybe break a cycle and start to feel like there is something you can do. That's the first step. And remember, these steps are baby steps to start with, as you add in these new little bits, but as they compound, they start adding together and adding up. The more you do, the more you can do. And the more you realize, the more you do, the more you can do, the better you're going to feel. The more control you're going to start to take back over your back pain, and really start to take control of the whole scenario, your general health and well-being. Addressing these issues is going to make a massive difference. It's going to take a little bit of time. But the important thing that maybe you didn't think of before you started this video is that there's 168 hours there in that week, and you have control over an awful lot of them. And the more things that we've mentioned in this video that you haven't been doing consistently over a period of time, because you can do them once and it just doesn't count. You have to do them consistently. The more things that we've mentioned in this video that you haven't been doing, which might make you feel like, oh man, I haven't been doing that, the better the outcome for you after watching this video, because we've just mentioned a bunch of things that you didn't know you could do, that you can do to really start to move forwards in the right sort of direction. So hopefully this video has been helpful for you. So I hope this video has given you a bit of encouragement, maybe a breath of fresh air. If you have found this video helpful, or if you've got any questions, because remember, some of those things you won't know. Ask in the comments below. You're watching a video online, there's a comment section, use it, ask questions. You don't need to have all the answers. If you did, you wouldn't have the problem. That's really important. And if you know someone else has been struggling for a long period of time, and because with back pain, you don't always see it, maybe they might be a bit demoralized, share this video with them. And if you found it helpful yourself, if it's really switched something on in your brain, then give us a thumbs up. Thanks for watching. I hope this video has been helpful. It's a really important one, and we'll see you in another video. If you want to learn more about the premium Back in Shape membership, there's going to be a video somewhere underneath here. And if you want to stay up to date or tune into some of our more recent live streams and the Q&As at the end of those, then that's going to be down here. And remember, you can subscribe to the channel up here and hit the notification bell to make sure you know when we next go live, so you can join us for our next live stream and Q&A.